So can each of you tell us a little about yourself and what first drew you to abolition and the work that you're doing now?
I can start. Hi, I'm Mandisa Moore-O'Neal, and my pronouns are she, hers. And it's rich that I'm in this conversation with Andrea Ritchie because she are one of the reasons why I came into abolition. At the age of 20, I had the joy and pleasure of joining this organization called Incite, INCITE, exclamation point. And Incite's work was it's like our goal, our mission was to build a movement to end violence against women of color. And to do that, we understood we had to address violence at these particular intersections of both intimate partner violence and also state violence, because that was what was happening in our lives. And so it was from a commitment to truly understanding what violence was, including state violence. And that was how I understood, abolition, it isn't just this thing that I learned about in history, of the 19th century chattel enslavement abolitionists, but these are people who I know and meet, and, we've abolitionist cats, who are, here in the 21st century who are doing this work. So I would say it was through an understanding and a commitment to addressing violence in the lives of women of color, especially as far as from my experience as Black women, that I came into abolition. Oh, and also, I think you said your current work. I have the joy and pleasure of leading CHLP, and having a space with folks who I respect to actually embody an abolitionist practice in our HIV legal and policy work.
I guess I'll go next because Mandisa set me up so well for that. And yes, the abolitionist cat has joined the chat. The cat came to me in 2020 and has spent a lot of time on Zooms talking about abolition since then. So always wants to be part of the party. I'm Andrea Ritchie. I go by she. I'm fine with any pronoun. I am the co-founder with Mariam Kaba of Interrupting Criminalization, a national movement resource hub dedicated to supporting folks who are interrupting criminalization. We're very literal with our name. And I came to abolition a number of ways. I mean, growing up in the global South, part of the time under a dictatorship, it was clear to me that police were not about creating safety. They were about repression and enforcing colonization and racial capitalism. And then as a young person, seeking safety from the police a couple times, learned very quickly that was not an option. And that resonated with what I had learned in my family. My mother and grandmother, both survivors of violence for whom police and the state never did anything, only community supported them. So that was sort of my inclination anyway, but still was sort of trying to figure out if we could make the police do the thing, and it never worked and it wasn't really, et cetera. And then one day, Angela Y. Davis came to my town, Toronto. I know the exact date because it was International Human Rights Day, March 21st, 1999, and laid out the case for abolition. And I just remember being like, oh, we could do that? We could just get rid of the whole thing? And from then on was fully on board. And so I often joke with her that, she turned me out as an abolitionist. But it was through the work of Incite that I really sort of deepened my analysis and praxis of what abolition means, which I know we'll talk more about today. So I'm so grateful, Mandisa, to you for lifting up that organization and legacy, because it was about approaching abolition through a woman of color, feminist of color lens, and holding the realities in our lives that we are surviving violence within what Beth Ritchie, my sister in struggle, names as the matrix of violence in our interpersonal lives, in our communities, and at the hands of the state, and how we have to hold those realities and abolitionist visions and practices. So as a survivor of all those forms of violence, is that it was also important for me to come to abolition through insight. So I will stop there.
Hi, I am Chris Henderson. I use they, them pronouns. I'm one of the co-executive directors of Amistad Law Project, based in Philadelphia. And I think that, I think there's like a couple of different ways I could answer this question. Hopefully you guys can still hear me. Okay, cool. I think one of the things that comes to mind first is being in law school at Temple in Philly, and I was doing a clinical with the U.S. Attorney's Office, and as a part of that, they had us tour the Federal Detention Center in downtown Philly, and as a part of that tour, they started us on the mental health unit, which obviously already sounds like the worst experience ever. And yeah, it was like pretty clearly a terrible place for people who were experiencing any sort of like mental health crisis. People were screaming, banging on their doors, and the people who were giving the tour were kind of like encouraging us to like look at people's cells. And it was like immediately like, we should not put people in cages. This is the worst thing ever. And I had like no language for abolition or anything like that. But just like this sort of like deep feeling of like, this is wrong. We need to do something else. And thankfully, pretty quickly, met some folks who were organizing a march from Philadelphia to Harrisburg, which is like a little over 100 miles, against the expansion of the prison system in Pennsylvania. And then, yeah, like now I'm here doing work trying to in mass incarceration in Pennsylvania, especially around death by incarceration or life without parole.
My name is Jada Hicks. I use she, her pronouns, and I'm the senior positive justice project attorney at CHLP, working alongside Mandisa. So thank you all for sharing a little bit more about yourselves. I think it's really powerful to hear how people arrive at this work, hear about the lived experiences and realities that shape not only the work that you do, but your experiences and the perspectives that you bring to this work as well. So now that we've heard a little bit about your past, I'd like to shift into a conversation about abolition and actually what it means in practice. So what I'd like to ask the panelists is that, abolition is a word that gets used a lot in different contexts and means different things to different people. I want to dig a little bit deeper into how each of you understands abolition. So how do you define abolition in your own work or life? And how do you describe it to people who think of it only in relation to prisons or policing? And I think it might be helpful here for people to hear an example or two of what abolition looks like in everyday practice, something people might not immediately recognize as abolitionist, but really reflects that approach.
I will start. I was actually looking around for no more police to see how we defined it there. But we define abolition as a world free from violence of all kinds, including the violence of policing, punishment, surveillance, and exclusion and detention, deportation, etc. And but it's important to sort of start with a world free from violence. So it's also a world where everyone's needs are met without condition, and where harm is, to the extent possible, prevented, interrupted, and that there's space and opportunity for accountability, consequences for harm, healing, and transformation, both of individuals who have harmed and been harmed, but also of the conditions that produce harm. So I think that's the important piece that people often miss. They're like, oh, world without police or punishment is just anything goes and there's gonna be more violence, when in fact we know as abolitionists that there will absolutely be less violence. One, because we'll have extracted the violence of policing and punishment from the system, and that already reduces violence by a certain significant amount, because of the violence that policing and prisons and detention and deportation wreak, but also because those things don't prevent or interrupt or heal or transform or offer real accountability and repair and reparations for violence. And so it is important for us to think about what would, and to think about, and from a practical standpoint, I do want people to just think about, like, how many times a day you navigate a conflict, you navigate harm, you navigate a need in a way that doesn't stuff it down, silence it, push it out of the way, but actually confronts it, addresses it, and transforms it without involving the state or systems of policing and punishment. And it's something that many of us, and most of us who are more resourced, are able to do every single day, multiple times a day. And it is really a question of whether we can make sure that there are the resources and capacities and skills and institutions and practices that will enable all of us to do that on a more regular, normalized basis. So that's where I would start to talk about abolition, both in theory and in practice. I mean, I think it is important to say that it is a theory and a practice. It is a theory and a strategy, a theory and a way of living otherwise, a theory and an entirely different kind of worldview and way of relating to each other, the planet, and to systems and relationships of power. So it's a complete transformation. As Ruth Wilson Gilmore says, it requires us to change one thing, and that's everything.
I feel like I have no additional definitions to add on to that. I think it's a perfect definition. I think in my life, the way I think it comes up most often is with my kids. Kids do a lot of things that you don't want them to, that are, I'm not going to say bad, but that are, not ideal. Things that, hoping as they grow up, they do less of, certainly. And I think, that initial instinct in me is often to, punish, to tell them that they've done something wrong, to to be like, I'm going to take things away. There are things that you wanted that now you can't have. And speaking about a practice, I think there's a lot that I try and do to, like, go against that. And because ideally I want them to be people who want to take accountability and want to be in good relationships with other people. And I think that is way more likely to happen if they know that they can mess up and it's not going to endanger our relationships or, get them in trouble. Like there's been a lot of moments, thankfully, where they've been able to come to me or one of their other parents in, like, our 4-person parenting pod. And, like, been like, hey, there's this thing I'm going through, which, like, I could not imagine having done as a kid. And so, yeah, I think it's kind of working. I think that's, like, one of the big ones. And, like, even in I think that's the one where I feel a desire to, like, sort of punish. I think in my relationships with, like, peers, I think I often feel like other people are not, like, don't want to be held accountable. Is, like, a thing I'm dealing with, and a thing I think is maybe not as true as it feels sometimes. But I think, like, really trying to lean into real reciprocity in my relationships is the thing I'm aiming for and working towards. That I think is, like, also abolitionist. So I think that's what I would say.
Oh my God, all of this is just so rich. Just to add into the conversation, two things. Like, one, like, it's a theory, but it's also a practice. And it's also like a lens and a framework. Like, how I think of it. This is also how I think of Black feminisms, because for me, how I came into abolition, it mirrors how I came into Black feminism. So for me, there is no Black feminism like that does not have an abolitionist lens. Is like I, reached a certain age and now have reading glasses. And that's how I think of like an abolitionist framework as well. It's a way like that helps me see the world so much clearer, and more importantly, how power is arranged. And so having like this abolitionist lens, like having this lens means like that I can see how power is arranged, and helps me think through what's actually needed, like to get the result like that we say that we want, which is no violence, or like an end to violence. Also, and this took me a very long time to learn, I think I'm still in that learning and unlearning, is I think there's so much of an emphasis on abolition as a framework to tear down, and to say, here's what we don't want, and here's what's shitty. And I got really good at that, at critiquing. And I'm so grateful in all the ways that I've learned, like that abolition, it mandates that we build what it is that we do want, and actually it was organized like that taught me that, right? Like I can't be out here saying, hey, person who just experienced intimate partner violence, cops are shitty and let's not call them, if I haven't like actually worked in community to say, hey, here are some viable alternatives in the moment that this has happened. And so I think like that's the part that is also important. And also how I came to that is understanding that certainly prisons and policing is a part of abolition, but, and Mariam Kaba has this quote that I'm going to paraphrase. I'm not going to say it directly, but basically we're abolishing the conditions that we think prisons and policing solve. And that was just like a light bulb for me in terms of, okay, it's the conditions, how we got there. And I don't think this part I've ever really shared with folks at CHLP, but also being 20 and experiencing Katrina, as somebody who's lived in New Orleans like my whole life, that was such an abolitionist moment. And of course, at that time, I didn't call it that, right? But in hindsight, I was like, oh, I became crystal clear what the state will do and then blame you for it. And that was part of like this journey as far as like, oh, okay, like we literally have to build systems because the state will literally let you die as the whole world watches and then blame you for it. And so again, like not too much, like only focusing on the tearing down and dismantling, which is a necessary part, deconstructing, but also what is it like that we want and need to see instead. And that's one of the reasons why I've been so excited about doing this work like at CHLP in terms of an opportunity to think through like what is carceral health and how do we center people living with HIV outside of a carceral health framework that only sees people with HIV as like disease vectors, but how do we see our people as folks who are worthy of all kinds of dignity in healthcare or health access to?
Yeah, I think you all have just provided some really great grounding ways to think about abolition, right? Like thinking about abolition as a theory and a practice, but even more so than that, it's something that we live by every day and building through daily choices and community care, like how we are going to be practicing in the real world abolition. And Chris, I loved your example of like even bringing it into parenting. It made me sit here actually and like, ooh, I need to start doing that myself as well. Like I always think of abolition in the terms of the work that I do, but not as a whole person. And I think that's something that we could probably all take with us on this journey is how it can really inform other aspects of our lives as well. And so I wanted to name two that holding this vision isn't easy, right? Abolition, and when you say you're an abolitionist, you're often met with skepticism. I mean, I don't know how many times I've heard people say like, oh, I could never be an abolitionist. Like, that's just not for me. And so I wanted to kind of hone in on when people talk and ask about harm and accountability and how we navigate what some would term as a little bit of tension between abolition and harm and accountability. So when you're challenged for not having perfect solutions, especially when asked, how do you address harm or deal with people seen as unrepentant bad actors, how do you respond to those concerns?
I don't think I've gone first yet. I mean, I think I definitely start off with like, it's not like we have a perfect system now. Like that's why we're talking about something different. That's why we're talking about what we need instead. Um, we have a system where the recidivism rate is 60-70%. Not to mention even if we're looking at the criminal legal system and like their sort of data, um, it's actually a very small number of people that are actually being charged with the things that they're deeming crimes, even the most serious ones. And there's like very few people that then are actually being convicted and going to prison for these things. And so we are already in a system where most of the people who the state is saying have harmed people are actually in our communities among us. Like they're not in prison, they're not being kept from us, and like we're not being kept safe from them, even in this context. And so like that's where we're starting. And like I think pretty much anything we do would be better than that. Like literally, if we just stop doing that, I think it would be better. Um, and I think actually the things that we're talking about are things that are pretty clearly going to help people, are going to make things better. Um, and what we have now is a system where at pretty much every level, um, we're talking about and we're thinking about the quote unquote worst of the worst, the people who have committed the most serious harms, the people who are unrepentant, which like I think anybody who works with people who have been locked up, the people who have committed harm, like it's just like really clear that that actually is just an incredibly small number of people. Like most of the folks that we work with have been convicted of killing other people, have been convicted of committing really serious harms. And they are people that, like, yes, I want to come home, and like, yes, would be an asset to their communities, to their families, to their loved ones. People who, like, yes, I would want them to like live on my block, and like, people who like I have been like, yes, come in my home and like stay here. And so the idea that like there are these people who are like monsters, I think actually just is not real. And like I think even like entertaining that line of thought is just like it's like I think we just have to actually like cut it off entirely, because that's not the world that we live in. The world that we live in is one where like people like yeah people harm each other every day, and most of the time nothing happens. And I think if there's something we can do to like reduce that harm, to like help people heal, like we will be better off.
Thank you for naming that, Chris. Working in the movement to decriminalize HIV and other stigmatized health conditions, I would say like that this is a common question. Honey, like folks call it my Black feminist card all the time, because they're like, how could you, a so-called Black feminist, work in support of these people who, and like who are, and this is language that's unfortunately used a lot, spreading, XYZ. Because it's this idea, right? Like that these HIV statutes are protecting women, when we know actually the opposite. Like these statutes actually mean like that women living with HIV are actually more likely to experience intimate partner violence, as well as state violence. And so just being clear, like I found it helpful just to ask the question, okay, so these laws started popping up in the mid 80s, and by the early 90s, most states had some sort of law in place to criminalize. It's been 40 plus years of what we call the AIDS epidemic. Have these laws stopped the epidemic? Which is what they said, right? That like these laws would mean that people like that these criminal laws like would stop people from doing certain things, like, and that it would result in less positives and all these things. The opposite is true. You know what I mean? It's like I always ask people, okay, well, if these laws are working, then why do we still have an epidemic? Like, so like having that question, but also having like a broader question of, has more law enforcement, more policing actually stopped what we think of as crime? And also being clear with people that crime is a social construct. Like I find, especially in this moment where, folks are working more and making less because things cost more, like I think of what's considered wage theft. It's only wage theft if it's a worker, like, but an employer, like a corporation, a CEO who steals labor from workers, that's not a crime. Like there are all kinds of things in place like to make that okay. So also being clear, like let's back up like a little bit and like think through what's considered crime. Like I live in the Gulf Coast where every oil company has dumped billions of oil into our water streams, right? Like that we drink and take baths and wash clothes and all these things. That's not a crime. But if crime is defined by harm, if crime is defined by someone having like an adverse sort of reaction, who are the people who determine what a crime is? So to me, like being able to have that conversation, is really important, because that's one of the ways like that I engage, like when folks say like, as far as, oh, well, how do you have this figured out? What's in place now and how is that not working? And again, it reminds me of the quote. Oh, I'm gonna get it wrong. I think it was Mariam Kaba as well. What you said, like the one of the roles of an abolitionist is to point out the inability of the state to solve the problems it has created. And so I think that, like, I always think of that in these conversations, like, how are you unable to solve the things that you put in place and that you say more policing, more of our tax dollars is going to solve?
I would definitely agree with everything that's been said. I think that the thing that's, when people are like, I'm just looking back at the question that you framed, like, for when we're challenged for not having perfect solutions, I mean, we are living in a 500 years long failed experiment of policing. So we can, I think some folks might respond to what Chris said, which is that, well, so many people are out there doing harm and are not locked up or kept safe from us, to be like, well, we should double down. We should police harder. We should, incarcerate harder. We should, detain, deport, expel, increase the death penalty, whatever. We should do all that harder. But it's not actually an argument for doing that harder. It's an argument for something that is continuing to fail because it wasn't set up to do what it claims to do. It's not out here to protect and serve. It's out here to maintain existing structures of power and privilege and violence. And so I think sometimes when people are looking, for instance, to criminal punishment to address some of the biggest harms we're seeing, whether it's genocide, whether it's the harms of this current regime, whether it's the harms of, ICE agents in our streets or whatever, they're not capturing the reality that the system was not set up to punish those people, and those people will never be punished, or it might be one occasionally as an exception to the rule to kind of give some legitimacy to the system who's, you know, been deemed expendable in terms of the structures and relations of power, whether that's one individual cop or one individual leader. But if you look at criminalization, it operates the same at every level, right? Including at the international level. Who gets prosecuted in front of the International Criminal Court? African leaders. Who engages in equivalent or greater forms of violence elsewhere? White people. And they are, you know, not or rarely in that situation. So, including around the violence of colonization that produced the violence and fuels the violence that takes place on the continent and elsewhere. So I just think that it is important for us to remember that criminalization is a political process, as you said, Mandisa, that extends beyond the operation, the passage, the enactment, the enforcement of criminal laws and policies and regulations. It's a political process that just names certain groups of people as inherently disposable, inherently threatening, inherently expendable, inherently expellable, and inherently, in the most extreme case of genocide, exterminatable, right? And like you said, what you described under Katrina, Mandisa, is very much what's happening in Palestine right now on a very, very accelerated and devastating scale. Not to compare, but it's just in terms of it's just expanded out. It's exponentially expanded out, and so I think it's important for people to remember that, because then we don't think of it as a system that could save us or could protect us or could be redeemed or could be reformed. We understand that it's a system set up to be doing exactly what it's doing. And what I think is really important to recognize, which is aligned with what you were saying about Black feminist politics, Mandisa, is that abolition is a survivor-led movement. And I think most people don't understand that. Abolition is a movement led by survivors of some of the worst forms of violence that we've experienced. Survivors of sexual violence, of fatal violence, of, you know, against family members, of gun violence, and they're people who know most intimately and most painfully how this system isn't working. And who know how the system, in fact, visits more violence on survivors. Because what people don't know, for instance, unless they're like me, a survivor of police sexual violence, which is that the police actually perpetrate many of the harms that we think of them as being necessary to prevent or stop, and often against the very survivors of the same form of violence. So survivors of sexual violence are among the primary targets of police sexual violence, often when responding to the sexual violence in the first instance. Police officers are some of the have disproportionate rates of perpetration of domestic violence, which is another thing. People are always about, what about the rapists? What about the abusers? What about, you know, et cetera, et cetera. And so I think that's a really important thing to recognize, is that where it comes to survivors of violence, 75% of us never tell anyone what happened, because we understand that more harm is likely to come to us from doing that, or it's not going to help, or it's not going to transform the conditions that made the violence possible. So a corollary to one of the quotes that you lifted up is that we don't just need to shift the conditions that make harm possible. We need to shift the conditions that policing and punishment both manufacture and make possible, by looting resources from our communities, by looting our capacity or to address each other directly in conflict, to navigate conflict, to engage in community accountability, to transform harm, because we've been bought into this idea that that criminalization is the way to solve our problems, including sometimes without calling on the state. We criminalize each other. We all participate in it in some degree, or we legitimize it, or we rely on it, or we use it as a way of exercising power, you know, or of understanding our own value. Like, I hold more value if someone does more time in a cage for harming me, or if a whole country can be, you know, eliminated because of harm I experienced in the past, or if a whole people can be, you know, decimated, or I hold more value if I can turn around and use the system against someone else who might have less power than me. And so I think part of the important thing is, one, to understand what the system is and does, and the purpose it serves, and what it doesn't do, and that this is actually a movement led by people who demand and deserve something else. that there's not going to be a perfect solution because, as Mariam is clearly present in the room with us, even though she's not on this Zoom, it's not going to take one thing to solve this problem. It's going to take a million things. If we keep looking to one perfect solution, we're just going to replicate policing, because it's in our heads and imaginations. We have to think about all the ways every day that we can prevent, interrupt, and transform and repair from conflict, harm, and need, and then lean into those. And then we get to practice and experiment, and we get to fail, because this current system is doing so at deadly rates, and we get to learn from those mistakes, we get to iterate from them, and we get to practice new ways of being in relationship to each other, new forms of governance, new forms of economic, social, and political, and emotional and spiritual relationships with each other that are rooted in the words of Insight's statement on gender-based violence and the prison industrial complex. We get to build a society that's premised on mutual accountability and passionate reciprocity and liberation for all peoples. And that is the one that we're trying to build. And we're not going to have a 10-step plan to get there. I'm a Capricorn. I really like 10-step plans, but turns out there isn't one. We just have to fumble our way there. But we need to do that with these principles in mind, that there's no way that policing, punishment, and exile are going to get us there. They're only going to produce more violence, and that's the failure of the approach and the system that it produces.
Thank you for naming that part about our ability to fail. That's something that I've seen is really challenging, in organizing spaces, also in advocacy spaces, because whether or not we think about it, we've really internalized these white supremacist messages of perfection, right? Especially I found this true of especially marginalized people, where it's this burden or pressure, of it's I'm one of few Black people in this space. This has to be right. This has to be the one time that it works. And how do we center our values and center that exactly what you said, of we're literally in an experiment that's failing miserably, and we are going to be in a process of always doing that. And I'm thinking of that in the most practical senses. I'm thinking of that when we try a new strategy. How do we end it after only trying it once? We haven't even gotten good at it and ready to say it's a failure. We're still, in this process of doing the thing. How can we then say after one attempt that it didn't work? And so just thank you for uplifting that. I'm going to be thinking of that. FYI, CHLP, I'm going to be thinking of this for our work.
Yeah, I feel the same, Mandisa, where I'm oh, that's made so much bubble up for me. Just thinking about who gets to define failure and thinking of it from that white supremacist framework. We've always been taught that failure means you did something wrong. And for me, what I teach in my house, hold and teach my kids, mistakes are how we learn. You cannot learn without making mistakes. It's just a part of the journey. And so we do have to try other things. And I think something that stuck out for me as you were all speaking as well is, we don't have to have this neatly packaged answer for this question in order to be able to still, Miriam Kaba talks about this as well, in order to critique our current system. And so I love that all of you offered really sound critique of the system as well, in a way that I really hope people take from this conversation and think about how they critique, how they participate in these systems and maybe contributing to perpetuating them at the same time. And I also want to build upon that. So I'd love to hear from all of you. What are some strategies that help you bring more people into this work or deepen their understanding of what abolition can offer?
I'll say one that is very relevant to CHLP's work, that CHLP is a founding member of, which is something called the Beyond Do No Harm Network, which is a network of healthcare providers across Turtle Island who are committed to interrupting criminalization in the context of access to care. with an understanding that, one, they have committed as healthcare providers to do no harm, and understanding that criminalization inherently is harm. It is literally punishment. It is set up to punish someone, which is harmful by definition, and that happens in the context of access to care, and that criminalization is ultimately the antithesis of care. It is literally the opposite of care, and that as Black feminists like Saidiya Hartman teach us, care is the antidote to violence. So if we want to stop violence, do no harm, and provide care instead of harm, then we have to interrupt criminalization in the context of care. So care providers have come up with 13 principles of ways that they can do that. And the idea is that you sign on to them, but you also apply them in your practice, in your institution, and in your profession or discipline. You practice them every day, right? Because we don't have a magical alternative way of providing care. So much of the way that we provide care right now is rooted in coercion and carcerality and punishment, even when criminal laws are not involved, right? And so we need to reimagine healthcare like we need to reimagine everything else, right? But we can practice that every single day. We don't need to wait for the perfect alternative healthcare system to be, because that would be in a whole different way of us relating to our bodies, to each other's bodies. It would require us to uproot ableism, racialized capitalism. There's so much that we need to shift, but we can practice that every single day in how we provide care and the systems of care that we create and build. And so it's important, particularly in the context of criminalization of HIV, because there's a way in which care providers participate in that, right? There's multiple ways. And one of them is by making you sign something saying that you will disclose your status to anyone before having any kind of sexual contact with them, right? And then should you have sexual contact with someone, whether or not it produces risk of HIV, whether or not it results in transmission, whether or not any harm took place, and whether or not you actually did tell them, and they turn around because they're mad at you later and they want to exercise power over you, including in the power of abuse and domestic violence, but also just power to feel powerful, will accuse you of having not disclosed your status and therefore put you in the realm of criminalization. And at that point, your care provider becomes part of your prosecution, because they will be asked to produce that thing that you signed saying that you would disclose your status. They may be asked to testify at your criminal proceeding. They may be asked to speak to your character at sentencing. There's a whole bunch of ways in which someone whose role is to care for someone is actually transformed into an accomplice or a participant in criminalization, which then is the antidote to care, because not only will you potentially be incarcerated, where you will experience terrible denial of access to any kind of care for HIV, including the things that would help you prevent transmission, and you will be potentially released in a situation where you'll be isolated from the rest of your community because you'll be required to register on some kind of registry, right? And therefore be, again, at risk of greater harm, because people outside of community are most vulnerable to violence, but also at risk of any number of health consequences, et cetera. So the criminalization there can happen not just through the enforcement of that criminal law, but then through how you're treated once you're inside a facility, whether you're detained or deported, and how you're treated and regulated through civil laws and other kinds of laws, and just also the ways in which we police each other in community and when you come home. And so we're inviting healthcare providers, healthcare advocates, healthcare receivers, healthcare people who care about healthcare and about health and well-being into a project of disrupting that at every step of the way. And so I'll drop the link in the chat if you're a healthcare provider or advocate or receiver and want to get involved in that. But I just want to really lift up and celebrate the ways in which CHLP has helped us see all the ways in which criminalization happens to HIV-affected people, and also people like Kenyon Farrow, who has been at the forefront of this conversation for decades and was also a founding member of the network, because it helps us understand the process of criminalization better, and also how we resist and interrupt it and actually move into a Black feminist practice of care.
Yeah, I think actually you gave us the perfect segue into our next question as well. So as we turn to HIV justice, I'd love for us to explore how these same systems of control and criminalization show up in the laws and policies that target people living with HIV. So you spoke a little bit to this, Andrea. So how do you see HIV criminalization intersecting with the broader systems of policing, prison, and punishment that abolition seeks to dismantle?
I mean, in addition to what Andrea laid out, oh my God, it just is, it's so great to hear someone who has offered us so much in the movement. I also think of work that you were doing, Andrea, in the late 90s, early 2000s around law enforcement violence and the way that it impacts not just Black men. You know, it's important to acknowledge how Black cishet men are targeted by law enforcement. And we are limiting our movement if we only focus on them, and like just your work, and how even if people don't acknowledge it was you, but that framework is such a part. That's also been like a part of us like deepening our understanding of what HIV crim even looks like, to to include pregnant people, you know, and the tools of the family policing system, right? Like some people just ask their doctor, hey, I'm thinking of, you know, chest or breastfeeding. And a call is made to a DCFS, you know, to CPS, excuse me. So like having a broad understanding of the ways that it happens, it means that, yes, it is a lot of the kind of jilted lover cases that we see, but it's also folks who are literally pregnant and living with HIV. You know what I mean? And it helps us to see the ways that it's folks who are criminalized via interactions with law enforcement, like how most of these laws are written. It's super, super vague, super, super broad. It includes someone who's accused of spitting on someone, right? Like who's accused, like, it was a man right here in New Orleans who CHLP was able to offer participatory defense support to. He was an unhoused man living with HIV who essentially was jumped. And so in his self-defense, he scratches someone. It was a healthcare provider in the hospital who disclosed his status out of the blue and for no reason. You know what I mean? So like literally it meant expanding our work, not just as far as working with state coalitions to like abolish these criminal statutes. It also means working with health departments, working with providers around, hey, I see you like to tell the cops people's status. Here's some tools to not do that. Like, here's the impact of what you're doing. Like maybe some way, shape, or form, you think you're being helpful. And here are all the ways it is actually the opposite of helpful. You know what I mean? Like, you know, and so having that conversation, but that has also meant expanding who are the people that we are working with. Like, as I mentioned earlier, it's often the case that this issue is really pitted as against, you know, anti-sexual violence advocates, right? Or like anti-intimate partner violence advocates in this way where it's like, no, like, how do we actually build their relationships with folks who are doing that kind of advocacy and show, no, we have the same goal here, is to grow the tools of safety that women with HIV have. And one thing that we see is that these laws actually serve as a tool that makes her less safe. And here's a research like showing that. And so it's meant like expanding and also like shifting the conversation. So how do we see this as a reproductive justice issue? If I understand that reproductive justice is about stopping the control of bodies, and I literally have this law in which people are now scared to engage in any form of pleasure, even to go on dates. How do I expand like the understanding of what that means, like to as far as to show up, like if we know that Black, queer, and trans people are disproportionately impacted, how do we ensure that HIV criminalization is always an LGBTQ justice issue? How do we ensure that like mainstream LGBTQ groups are showing up, you know, in this work and seeing it as a part of the work that they say that they're going to do? But last, this is why I'm so excited about Chris, is how do we also ensure like that we're seeing our work as a part of an abolitionist framework more broadly, because something like that I see is, it's still a conversation that we're having about how is HIV justice a part of the larger abolitionist framework. And so it's been exciting, like, to be in those conversations and to, expand who is seen as like a person who's experiencing this. Because at the end of the day, like, we understand that people who are trans can also be people living with HIV, are also people who are immigrants, are also people who are experiencing or have experienced an intimate partner or sexual violence. So how do we ensure that, like, there's space in our organization, in our analysis, like, for people to, as I learned from Insight Day One, how do we make space, like, for folks to show up as their full selves and not feel like, oh, this is a space, like, where I can't talk about living with HIV, or I can't talk about being an immigrant over here, but all of that at the same time.
I think Mandisa and Andrew both answered this question really thoroughly. I think the only thing I would add is that I think that HIV criminalization is sort of like an example of, like, the deeply anti-science, like, bias and rhetoric that's, like, been pervading our country for years and years and years now, which, like, I think we all know the many terrible things that come about as a result of that. But, like, the reality is that, yeah, if we're actually talking about harm and the harm of people who are living with HIV, like, engaging in, many different acts, it's like, if you are actually looking at the science, it's really clear that because of, advancements that have been made over the past few decades, that, people who are living with HIV are able to live healthfully and live for decades with HIV, that people are able to engage in many different acts, including sex acts, with, like, relatively little or, like, essentially no risk of transmission at this point in time. And so we know that it's, like, not actually about safety. It's not actually about harm. It is purely about punishing people. And also we know that, like, the people who are going to be punished under these laws are going to disproportionately be Black and brown people, are disproportionately going to be queer and trans folks.
Thank you for naming that, Chris. I think it's helpful to conceptualize how HIV justice really is a part of the larger abolitionist framework. I think sometimes people get really confused by what that could mean. I think you all gave some great examples of what a journey it is to be an abolitionist, right? And how we can apply that in the larger HIV justice and advocacy space as well. We have some questions that are popping off in the chat that I would love for us to get into. So our first question: restorative and transformative justice can repair, but sometimes people continue to cause harm even after being given multiple chances to heal or be accountable. How do abolitionists respond to repeated harm? What is the consequence?
I mean, I don't know, Chris, are you going to answer? Maybe you have a better answer than I do. I mean, I think it's very situation specific. So I think that's also what like, police is like one size fits all solution. The only, response they have is like handcuffs, a cage, and a bunch of other coercive practices, right? Which, as we've pointed out, don't actually transform the person who did harm, the person who was harmed, or the conditions that produced the harm, right? So I think it is making sure that whoever is doing the harm and is not stepping into accountability and transformation is removed from the situation where they have the power to do that harm again in the future. So an example I learned early on in Insight, for instance, was of a situation where someone was harming children, and the people in their community just made sure that they were never around children alone, right? But that didn't mean, and that they also imposed a consequence of like, and actually we're not, you haven't figured out your relationship to touch. You need healing around your relationship to touch and non-consensual touch. And so none of us are going to touch you. You can be in our spaces. We will feed you. We will be in conversation and community with you, but we're not going to touch you. And we're not going to have you around children without someone else there until you have moved through a process of healing and transformation. And when they felt satisfied that that process was complete, they warmly welcomed them back into community. And the way they described the process of like welcoming someone back in with a hug after a long time of like holding that boundary, and what it meant to everyone involved. Like, I'm still tearing up about it because it was such a moving example of like, we're gonna hold a consequence. It's gonna be hard for everyone, but that consequence is not endless, and it's not that you'll be defined by this for the rest of your life if you do the work, if you step into accountability. And if not, then we're going to make sure we're not just going to exile you from our community where you can go do the harm somewhere else. We're going to hold you in our community and make sure that there are boundaries around what you can and can't do that take away the power for you to do this harm here or anyone else. And that, you know, how you do that is tricky without, you know, we have to keep asking ourselves, is this policing and punishment, or is this a consequence? Is this policing and punishment? Because the person who's experiencing it might be like, that feels like punishment to me, and or the person who was harmed might actually want punishment but call it a consequence. And so I think we have to just constantly be in conversation with ourselves and each other about what we're doing collectively. But it does not mean that if someone refuses to step into accountability, cool, like, or that we just say, you're out of our society, go do harm across the country, across town, in another country, in another space, and we're going to be, because we've just thrown up our hands in the air. We can't do that. And I'm so sorry for all the noise outside. I hope that came through.
So I think I love the framing of like, that doesn't mean there are no consequences. And the real question is really like, how do we address the conditions that produce the harm in the first place? While also knowing that teaching and learning can really be a community process. I think sometimes these are really new concepts in our space. And so I love really how you broke that down for us. So our next question is, as a part of the public health system, which prioritizes knowledge of status and testing as a way to empower a person, how do we balance that with the knowledge that not testing and not knowing one's status can help keep people safe from criminalization?
I love this question. And first, I'm also still processing the first question. My experience is also that we don't actually know what accountability is and looks like. And that's okay. It's not like we have examples of it in the world we live in. And we quickly move to an accountability process that then like is relying on like punitive models, right? So something I've learned as someone who's held a lot of transformative processes is you can never overstate the importance of being in a relationship and community with the people who you're engaging in accountability with. And also like having clarity that not having a punitive response is not the same thing as no consequences for your actions. And I think like that's why I'm always talking about like the importance of like being clear what accountability is and not skipping over like the importance of knowing that like before like moving into a accountability process. Because if we don't know, then all that happens is we say accountability and we just end up being cops, but in a circle, basically. So like the second question, I really like in terms of that is the conundrum of these HIV criminal statutes. The cornerstone of the epidemic has always been know your status, because it gives you so much information, right? Like if you test and the test comes back, as reactive, like here are your treatment options, right? Like now, like post 2012, if you test, and it's negative, like you have the option, of PrEP and what that means and other prevention tools. How do we have a criminal legal system that discourages you from knowing the status. So for me in these questions, I think it's important not so much like to focus on the individual actions, but actually like the systemic barriers to actually being tested, like getting tested. You know what I mean? Like folks are clear, these laws serve as a barrier because literally how they're written is knowing your status is enough to be liable. You know, as Andrea mentioned, it is a requirement like that you know, even engaged in an act that had a possibility of transmission or that transmission occurred, like just knowing is enough. So if I'm out here in this world, why would I want to know my status? That's my best defense. So, but then my concern is in these situations, there's such a emphasis put on the person and the individual act that I push back and say, no. What are the systemic barriers here? Let's not blame the individual for something that is actually a systemic issue, like that can easily be solved here. These laws are a barrier. So I think it's just helpful to start there in the conversation.
Thank you, Mandisa. So much knowledge here. And I really wish people would understand that the barriers to testing, which are created by HIV criminal laws and the data that we have to support what we've known anecdotally for years in community, that they do more harm than good. And that we know carceral approaches do more harm than good, what we saw in response to the COVID pandemic. I was so hopeful that we would see more of that response that we saw during COVID implemented in the HIV advocacy space. And we really haven't. And actually our next question brings in COVID as well. So as a multiple disabled person, a challenge I have experienced in various communities that want to divest from the nation state intervention still don't mask in public spaces or get tested for COVID. What are suggestions that may be more effective in bridging the abolitionist values of community care and interdependence with masking, especially when the language of bodily autonomy often only focus on the individual?
I mean, I'll just answer what I answered in the chat, and then also I'm gonna have to excuse myself. So I apologize for that. I know that this conversation is critical, and I've been rich, and I've been really looking forward to it. And I'm sorry I have to leave early, but in the chat, I was saying, you know, we can't believe that we're going to get to a world that's premised on, you know, mutual accountability, passionate reciprocity, and liberatory futures for everyone if we can't exercise community care in relationship to each other, right? With wearing a piece of cloth over our face or a piece of paper over our face in order to protect immunocompromised people, or people who just don't want to get COVID or don't want to get any other respiratory infection, measles, for instance. And so, we have to be able to balance self-determination and autonomy with collective and community care. And that's true for everything. You know, there are days when I just want to act in ways that are not consistent with my values and with community and collective care. And I have to figure out how to manage that for myself. It might mean, well, then I don't go into certain spaces or do certain things, but on those days, or that we figure out a way to negotiate those boundaries. You know, if someone can't wear a mask because they have their own respiratory issues, then the rest of us do, in order to make it possible for them to be unmasked and the rest of us to be protected. We have to figure out ways of negotiating collectivity in a society where we've been taught that self-determination and autonomy means like me. Self-determination is collective, bodily autonomy is both individual and collective, and we need to figure out how to navigate that in ways that align with our values. And I will look forward to watching the rest of the conversation so that I can hear everyone else's brilliant answers. And thank you all so much for having me and hosting this conversation.
Thank you.
Thank you so much, Andrea.
Thank you. It was good seeing you, Andrea.
Chris or Mandisa, I didn't know if you had anything that you wanted to add for that last question.
I don't think I have anything that's super well formed, but you know, I can certainly ramble. Yeah, I think that like this is an issue that kind of, I think to me sort of begs the question of like how is it that we want to show up for each other, and how do we, like, what do we think community means? Because I think ideally there are like ways in which we're like, I have to do something I don't want to do, or I have to not do something I do want to do because like I'm trying to like keep this larger group of people, this larger community safer. Um, and I think with COVID in particular, um, we have been presented with this issue of like, we know that the people who are most impacted are people who are already living with disabilities, and so it's not like an amorphous, this is for me versus like these other people. It's like this is me, and then it's like there are people who have needs that are greater than mine, and so how do I view my autonomy and my ability to do what I want to do in relation to people who have greater needs than me? um, and I hope that most of us leftists are falling on the side of like being like, yeah, I do want to. It is not a big sacrifice for me to do a bit more so that other people are safer. Um, and we're kind of seeing how that's playing out. It's in process, but my hope is that is where we mostly land.
Yeah, I'll be brief 'cause I know we have to end, but a Dr. Lauriane, I just appreciate this question. I know this is work like that you've been doing for a while in community. And I think this question like also exemplifies like how sometimes we don't like how we use language. Like I've been in spaces where someone's been asked to put on a mask after it was made clear on a flyer, right? Or like it was mask available at the sign-in table of different sizes and shapes for people's faces and breathing needs. And at one point, someone was told, "You're policing me like by asking me to put on a mask." And it's like, here we go with like the misuse of language, right? And so like it ended up being a good moment in that like we kind of had a conversation about what words mean, and a policing is this. Somebody asking you to something that you agreed to do is actually not policing, it's actually holding you accountable to values that you said. Like it was on the flyer, like all these things. And also it was a chance, as far as to be clear, what is a punitive response and what are consequences, right? So like here's an agreement that's been made. For whatever reason, you decided not to put the mask that has been provided. You will be asked like to leave the space, right? And like some people feeling bad about that, like, oh, that's punitive. No, it's not. There are consequences to certain things. So like I feel like there are those situations. And it's also like, how do we have the conversation? Like I know it's a big thing of like folks have flyers and don't put any accessibility information on it. I know at CHLP it's been a growth edge to like think through how to have language services, ASL, Spanish, other languages. Like for me as a director, it's meant how do I make sure it's in the budget? How to make sure it is money for it? Like how do we have like relationships with groups who can do interpretation and translation? So again, just thinking of like all that's needed. And my experience is being able to show up and say, we didn't do this. How do we make sure it's done moving forward? And that isn't something that I always see, even in like abolitionist spaces, like an ability like, or even a willingness to show up and be like, hey, I would like more support in thinking through how to do this thing. Or I actually don't know what this thing is. Can we talk about this? Like, what is community care? And I agree, it sometimes is easier like to focus on the individual and not like the system that makes it so hard for everyone to mask or to get COVID testing. Like I remember when it was much more easy like to get a no cost COVID test. And that's not the case anymore.
I love, Mandisa, too, the framing of it's accountability. It's not a punitive approach. I think people oftentimes think of accountability as a punitive response, and it's not. So I thank you for naming that and calling that into this space. I also just want to take the time to thank all of our esteemed panelists. This has been such a rich conversation and really an amazing webinar. For our attendees, I hope we have given you some practical tools and examples for applying abolition in everyday advocacy, policy reform, community-led solutions, and honestly, just in your everyday lives. I want to just note that this is only the first webinar in our series. So this series was really created and intended to foster a space for folks to connect HIV justice to broader social justice movements and explore how abolitionist principles can guide our work towards justice, care, and safety rather than punishment. So please stay tuned for our announcements for the next webinar in these series. And thank you so much for tuning in today and joining us.